we're doing things to reassure our patients and reassure our staff. It's really important to keep your staff engaged and to make them feel like they're in a safe working environment. We see other professions that don't want to go back to work, and yet the frontline medical people across the board, we've heard no complaints, and there's been no hesitancy for frontline medical people to assume the responsibility of taking care of patients, and our staff is different. But at the same time, we feel like we've got to protect our staff. So we have certainly outfitted everyone with the appropriate protective gear, the surgeons as well. We test all of our surgery patients 2 days before surgery. It's a 24-hour test. We require a negative COVID test with obviously a negative history associated with it. And then we ask our patients to quarantine for that additional 48 hours prior to the surgical procedure. So we feel probably safer in surgery than we do in our clinic. In our clinic, before people can even get to our reception area, we have people screening in the lobby of the first floor of our building, and then transporting one by one up our elevator to our third floor clinical area. And prior to that, we've taken a history and we've taken temperatures and the usual things. We ask people that have traveled to particularly hotspot states to quarantine, for 2 weeks before they come into our office as well. So that's something a little bit different that we didn't do at the beginning. But with the recent surge, we have asked people that are traveling to certain states where we know there's a prevalence of COVID infections that they need to give it a couple of weeks before they come into our office. So we are taking the appropriate safeguards. Obviously, we have antiseptic hand washing stations in the lobby of our building, and after you get off the elevator and outside every exam room. We're really big on that. And we have all of our staff change into scrubs out of the clothes that they've worn from home. And we do ask all of our staff, even though it's certainly not the most popular thing we've ever asked them to do, but we do ask them that if they travel, they too have to stay out for 72 hours and then get a COVID nasal swab test, and they have to be negative. So we're safeguarding our patients, we're safeguarding our staff, we're safeguarding our surgeons as best we can. We've only had, at this point, anecdotally, I think 2 cases that have canceled because of positive PCR or COVID test. One was for rhinoplasty and one was for another body procedure. The one for the rhinoplasty was asymptomatic and tested positive. The one for the body procedure, as I understand it, was hospitalized. And I'm not sure how she's doing it at this point, but that was only about a week or 2 ago. So out of all the procedures we've done, we've probably done, I don't even know, we average 4 or 5 procedures in our surgery center a day. We have 2 operating rooms. Some of them are bigger cases, and over a 2.5 or almost a, I guess, 2.5 month period, a little bit more than that now, out of 200 procedures, we've only had 2 tests positive